I'm Carmela Carr. I'm the president of the North Bethesda Rotary Club. The crowd goes wild, I know. And so we are very excited in our inaugural event to have partnered with two organizations here in Montgomery County, MobileMed and Mercy Health Clinic, two very deserving health clinics serving a great need in our community. And I know our members were very excited to partner with these two organizations. Welcome to the North Bethesda Rotary Club COVID Challenge 2020 Kickoff. We're excited that we have such a wonderful participation. I know, really, our masks. Hopefully you got your mask in the mail. Woo! And we hope that this event becomes an annual mainstay in our community. This is our inaugural event for our Rotary Club, and so we're very excited. And when I'll give you a little background. When the fundraising committee started the planning process and started thinking about what could we do and how could we do it, we thought we wanted to achieve two goals. One was to, well, actually three, not only raise funds for our community, but also bring awareness to the organizations that we partner with, and also about Rotary, because sometimes I think Rotary is one of those best kept secrets.
With Councilmember Friedson here, I would say that could we provide him a moment to greet us?
You know, moments of crisis are times of character, and it's really amazing to see how our community has stepped up, and never has it been more clear than during a global pandemic, the likes of which none of us have seen in our lifetimes, that personal health is public health. And Mercy Health and MobileMed, that's the world you live in every day. But for most of us, that's a new concept. You know, personal health is our own, and public health is something that's distant and almost foreign. And it's not true. Our health is everyone else's health, and everybody else's health is our health. And our ability to live a productive and healthy life is entirely dependent on how healthy the community is around us. And that's true for schools, it's true for workplaces, it's true for public places. And the work that you all do every day in normal times is critical, and in this crisis is absolutely essential to make sure that you're not just serving the residents who need health support, who otherwise wouldn't get it without you. You're serving all of us, and you're making sure that we have a community that's healthy and that's safe. And I think we have a newfound appreciation for all the work that you do. And the Rotary Club of North Bethesda, I mean, I can't say enough how much our Rotary clubs, this Rotary Club, all of our Rotary clubs, and our nonprofit community civic sector has stepped up to help out neighbors. It has just been awe-inspiring, and it has been absolutely essential. We don't do this alone. We don't do this with government by itself, or with the private sector by itself, or the nonprofit or the faith sectors by itself. This is a community effort. It is a global crisis, and we need everybody holding hands by being socially distant apart to be able to get through it. And this effort, focusing on personal health and on public health, on everybody helping each other out to be part of a shared and joint effort. It is everything that this crisis needs. It's everything that our community requires, and it is the lighted path forward. I will say one last thing. Bethesda, the name of our community, North Bethesda and Bethesda, you know, comes from the Bethesda Meeting House, named for the church. The word Bethesda comes from the Aramaic Beit Chesed, or Bethesda, which is Aramaic and Hebrew, pool of Bethesda. It means house of mercy and house of loving kindness, depending on which language you're interpreting it from. That's what this is. And so talk about a way that we are embodying the type of community that we aspire to be and to become. You all are doing it, you're living it every day. And I just want to thank you for everything that you are doing for our community, for each other, and for helping us to get through an unprecedented moment in unprecedented ways. So thank you.
Well, thank you, Congressman, for your encouraging words, and we truly do appreciate your service to our community and taking time out to be with us for our inaugural event. So thank you very much. So at this time, I'd like to give our partners an opportunity to tell you about their organizations, and I'm going to start with MobileMed and turn it over to Michelle.
Thank you, everyone. I'm Michelle Levy, the Director of Development and Outreach. I'm pleased to introduce our Clinical Director, Kathy Luton. She'll be speaking to you about MobileMed. We're really appreciative of all the volunteers that have come together to work on this, especially our very own Dr. Bacaresa, who is also a member of the North Bethesda Rotary.
Well, thank you, Michelle. My name's Kathleen Luton. I'm the clinical director and a nurse practitioner at Mobile Medical Care. And today was my first day back in the clinic after 5 months out trying to manage this pandemic. So I'm not in the clinic right now. I had an opportunity to come home and do more hair and makeup. So here I am. MobileMed started about 50 years ago by two physicians who worked in this area. And they found out very clearly that a lot of low-income people did not have access to health care. So and over the years, we went from a totally volunteer organization to paid and volunteer now. And we have about 50 employees currently. About 5 years ago, we became designated as a federally qualified health center. And that's the only federally qualified health center that's totally located in Montgomery County. And this week, we were recognized with a Gold Quality Leader Award, and in recognition of ranking among the top 10% of all health centers in the country. So we're very proud of that. On the donor side and philanthropy side, we are recognized by the Catalog for Philanthropy as a top small nonprofit in the DC metro area. More operationally, we have 3 fixed sites and 3 van sites that we provide primary care to. One, right now, the vans are not being used because of social distancing. We also have a partnership with Suburban Hospital and the National Institutes of Health and provide both a cardiology clinic as well as an endocrinology clinic to patients who are uninsured and Montgomery County residents. We have reached out to many of our patients during this pandemic, and as you are probably aware, many of our patients are in high-risk groups for multiple reasons, for chronic disease reasons, for multi-generational household reasons, for high-risk professions. So with donors' help, we were able to really proactively case manage these patients and make sure that they had enough medicine, and if they were employed, were they doing okay? And if they weren't employed, did they need rental assistance or food assistance? And did they lose their health insurance? And can we help by getting them back on the Medicaid rolls or what have you? We also pretty rapidly started doing telehealth and teletherapy. So I think Maryland shut down sometime in the middle of March, and by the last week of March, we were up and running doing telehealth and teletherapy. Our highest risk patients, people who have artificial valves or very serious conditions that are difficult to manage, we realized that we were going to have to put some extra effort into that. And so we decided to provide medication delivery and some point of care testing for those people. And that has worked very well. As part of our community outreach, we're probably going to be doing this for a long time. So we have identified that, we've made it into what we do now. So it's not just during the pandemic, we're doing it every day, every week, and making sure that patients are in fact cared for. And as we move through the fall, we are reopening. So we are balancing telehealth with inpatient clinic appointments so that people do not lose that physical exam component that had been lost for the last 6 months. So it's been a pleasure speaking to you and letting you know a little bit about MobileMed. I'll give you back to Michelle or to Carmela. Thank you so much for hosting us tonight. We're very appreciative, and we're looking forward to this challenge. Thank you.
Thank you, Doctor. Michelle, was anybody else from MobileMed before I?
Peter Lowett on the phone as well.
Awesome.
I acknowledge him.
Yes.
Yeah, I'll just so thank you. I will echo Kathy and Michelle's comments. We're really happy to be part of this collaborative. I'm thrilled that Councilmember Friedson really framed this whole piece. It really has been the entire community stepping up during this crisis, and it's really been humbling to be part of this community, even as the going gets tough, that people are so philanthropic and people are really thinking about how to serve our entire community, but most particularly our most vulnerable neighbors. So thank you, and again, on behalf of the entire MobileMed team, happy to participate and look forward to a really successful event.
Awesome. Thank you, MobileMed. So now we're going to hear from our second partner, Mercy Health Clinic. I'm going to turn it over to Denise.
Hi, everyone. My name is Denise Fredericks, and I'm Director of Development and Communications here at Mercy Health Clinic. I'm also a Rotarian, and we are proud corporate members. Mercy Health is of the Rockville Rotary Club, and that's been a wonderful partnership. And you know, Rotary does a lot of great things around the world, and Mercy is doing a lot of great things around the community. Each year, our clinic in Gaithersburg, Maryland, serves about 2,000 patients with about 7,200 office visits. Our mission when we started 20 years ago was to provide high quality primary care, specialty care, health education, and medications free of charge for patients who were low income and uninsured. And as Councilmember Friedson framed it, never has that mission been more important perhaps than it is right now, when we are reminded how closely our health outcomes are connected to the health outcomes of others in our community. Our patients, being low income, struggle with the conditions related to poverty and long-term lack of access to healthcare. And patients that we see are overrepresented in those who have experienced COVID in their households or themselves. Right now, about 40% of our patients that we're seeing regularly are experiencing COVID symptoms. They may not actually have COVID, but you know, if you have asthma and you have a sudden asthma attack and you can't breathe, running to a doctor because you can't breathe is important, whether or not you have COVID or whether or not you have an asthma attack. And I say that as an asthmatic. So when we're trying to serve our patients, we've really focused a lot. We embraced telemedicine early on, as did our friends at MobileMed. We've been bringing in patients who need to be seen by a medical professional, just because we don't want our people having to go to the emergency room where they could, especially early on during the pandemic, when we were in our crisis and every person in an emergency room was an emergency room crisis because they were running out of capacity. So anything that we could do to keep patients out of the emergency room was what we were actively working on. So we focused on patients that had chronic conditions like high blood pressure and diabetes. That accounts for about 3/4 of our patients. I mean, a third of our patients probably have chronic conditions like high blood pressure or diabetes. And to make sure that they have medication, that we're following up with them, that they're coming in for lab draws, and we're checking their blood just to make sure that there's nothing going on in the background while they're all quarantining at home. Each year we raise about 60% of the money that it takes for us to serve our patients all year long. So activities like this wonderful COVID challenge are a wonderful way for us to engage the community in the work that we do. We look to individuals and community partners all the time for, how is it that we're going to make sure that we can serve the people who need our services the most. So for us, the COVID challenge is really an opportunity for us to get healthy. I've already signed up to do my 25 miles in the month of September, and I hope to well surpass that goal. And it's also a chance for you to provide health care for those of us, for those people in the community that need our help the most. So I call that a win. Thank you so much for getting involved, and good luck in your COVID challenge.
Awesome. Thank you both so very much, to MobileMed and to Mercy Health. I'm going to turn this over now to Dr. Barry Thompson, who is with the North Bethesda Rotary Club Foundation, and tell us a little bit about our Rotary Club Foundation and what we do.
Well, the Rotary Club, the Rotary Charitable Foundation of North Bethesda is a 501c3 entity which has for decades participated in local, state, national, and international projects. Probably familiar to many of you in the viewing audience are scholarships to Montgomery College from students at Rockville High School, the awards to student vocational leaders at Edison High School in Silver Spring. The club has participated for years in automotive trades programs at Montgomery College, and in the past supported disaster relief both locally and nationally, and on its own in collaboration with other Rotary clubs and projects in South America, Africa, and most recently in India. So we're proud to partner with Mercy Health and MobileMed in a new endeavor that will allow us to continue charitable outreach both locally, nationally, and internationally with other Rotary clubs and on our own. Thank you so much for the help.
Thank you, Barry. Appreciate that. Now, Kevin, are you ready?
Okay, I have with me, I'm here in Swan Lake in Maine, and we have our two of our Flynn participants. Can you wave, Jessica? They're signed up and ready to go. We have the dog Homer, he's with us. And I've got my paddle, so I'm going to be paddling. I'm not sure how far. We'll see. Anyway, we had real good response to the COVID challenge. We've signed up a lot of folks. We can hope to get more. We've raised some money. We hope to get more. There'll be instructions being sent out soon about how to record your adventures during the month of September and other stuff. We're going to get a lot of social media. We have a nice article on the Bethesda Beat website yesterday that was very helpful. And what can I say? Everybody get out there and move.
Well, it's time to get walking, running, biking, or rolling. As Kevin mentioned, don't forget to record your miles, and on the race sign-up page, take a picture of you wearing your mask. Send it to us. We'll get you posted on our social media sites. And we want to still encourage family and friends to sign up and participate. We're going to keep sign-ups open through September. So off we go. Time to get running, walking, and biking. Thank you all.
Okay. Thanks, everybody.
Thanks, everyone.
Thank you.